Good morning, Kathy.
Thanking all of you for coming out to support us this morning. After months of organizing, we are here today, proud and standing together in unity, to speak out about our efforts to unionize with the National Union of Healthcare Providers. We are the providers of AIDS Healthcare Foundation. We are doctors, nurse practitioners, and physician assistants. We are the ones at the front line, providing HIV primary care to thousands of people living with HIV and AIDS throughout California. And yet, we have absolutely no voice in the policy decisions at AHF that directly affect patient care. Instead, it's AHF CEO Michael Weinstein and his team of health administrators, none of whom work in the healthcare centers or have any first-hand experience in patient care, that are making all the decisions without even consulting with us providers or listening to our feedback and suggestions. And their decisions are driven by numbers, increasing productivity, cutting staffing, all for the sake of profit. We, the providers of AHF, have made several pleas to administration to make them recognize that the HIV/AIDS community has special needs when it comes to health care. And we want to preserve the integrity of the care we provide to this vulnerable population. This is not assembly line medicine. This is medicine with a heart and soul. We are healers. Healers who know what it takes to truly help people living with HIV and AIDS. It's not simply about prescribing antiretroviral medications. No, it's about helping our patients learn how to live with HIV, to understand their antiretroviral treatment and the importance of medication adherence. It's also about understanding and addressing other issues, like patients' needs for stable housing, for reliable access to food. And it's about listening to our patients and identifying things like depression and other mental health needs, even when patients don't recognize it themselves. It's about addressing substance abuse addiction and providing counseling and support through setbacks like relapses. As providers, we know that to be successful, we need to build a partnership with our patients. In a statement yesterday, Michael Weinstein refers to the many patients at AHF that have fallen out of care, supposedly because they are unable to schedule an appointment at the clinic because the providers don't have enough open appointment slots. This couldn't be further from the truth. The truth is, when patients need to be seen, we will find a way to see them, even if it means working through our lunch hour or working late. But not surprisingly, Michael Weinstein is so quick to blame the providers because he lacks the experience to know that patients fall out of care for so many other reasons. As I mentioned earlier, unstable housing, drug relapses, depression, all things that we could better help our patients navigate if only we had better ancillary staffing and mental health support. This is one of the things we will fight for if we have a voice as a union. And he fails to recognize that patients stay in care because of the strong, trusting relationships they develop with their providers. Over the years, AHF has had an abysmal turnover rate, losing many highly qualified providers who grew frustrated with the top-down management at AHF and who were able to find much better working conditions elsewhere. Poor provider retention means poor patient retention. The high provider turnover is another crucial reason why patients have fallen out of care. There is no provider-patient partnership when patients see a different provider at each visit. I, myself, have been a provider at AHF for over 10 years, and I am proud to stand here among my colleagues, who I can truly say are some of the brightest and most dedicated providers I've ever had the joy of working with.
You rock!
Yet sadly, AHF does not see this valuable asset. They would rather point fingers and say that we are not working hard enough, not seeing enough patients, when the truth is, we have absolutely no issues with working hard when it comes to helping our patients. The difference is, we measure our work in terms of quality, not quantity.
Amen, sister!
In a statement that came out yesterday, Michael Weinstein says that the medical providers at AHF run the medical program, that the clinics are supposedly run solely by us. Well, I'm here to tell you that that statement is a flat-out lie. We wouldn't be here if that were the case. Many of us have been given titles like medical director or regional medical director, which make it sound like we have decision-making power, when in fact, these titles are in name only. We filed our petition to unionize almost 2 months ago, but at the moment our efforts are on hold, blocked by Michael Weinstein, who claims that the medical directors and regional medical directors are supervisors and therefore by law cannot be part of the union. The truth is that none of us providers meet the definition of supervisor as defined by the National Labor Relations Act, because none of us actually have any decision-making power at AHF. And in this statement, Michael Weinstein also implies that we have lost the battle with the Labor Board on this point, when in fact the Labor Board is still actively investigating the issue, and we are quite confident that they will side with us in the end as truth prevails. Remember, the fundamental reason why we decided to unionize was because we had no voice, regardless of title. As a union, we hope to get a collective voice in policy-making decisions that directly impact the patients we care for. Lastly, in his statement yesterday, Michael Weinstein claimed that the so-called supervisors harassed the other providers who signed the petition to unionize. This, too, is a flat-out lie. In fact, standing in this crowd around me are many of the so-called line staff, as Michael Weinstein referred to them, who are, in fact, highly educated, highly experienced professionals, free-thinking adults who made the decision to sign on of their own free will. So, we stand before you, the providers of AIDS Healthcare Foundation, to make it known that we are unionizing because we want to preserve the integrity of patient care. We want Michael Weinstein to do what's right. Recognize our union. Thank you.
Way to go, Kathy!
Ready to fight for patient rights! Ready to fight? Ready to fight?
Patient rights!
Ready to fight?
Patient rights!
Ready to fight?
Patient rights!
We're ready to fight?
Patient rights!
We're ready to fight?
Patient rights!
And we're ready to fight!
For patient rights!
All right.
Woo!
I'm going to introduce a patient, Savannah Brand. She's a longtime patient with us, and she's going to tell her story.
All right, Savannah!
Hi, I've been a patient at AHF for 14 years, and over the 14 years, I have had so many more problems than I should have. First of all, there's no women's clinic, and there's nothing for women in AHF. Second of all, I have no time with my doctor now because she has to see 100 patients a day, or whatever it is. So I'm rushed out of there like I'm in a cattle call. I need to have more quality time with my doctor. There's not enough time with doctors, and I need to have more referrals in a more efficient time span. It takes me 3 weeks to get a referral now to see another doctor outside of AHF. So I need to have that done and have my doctor give me more time and not rush me out of there because she's got to see the next 100 patients in the next hour. And women's clinics need to be opened around this age. Nothing for women. I've been so discriminated against as one of probably, I don't know, I've only ever seen 2 women in AHF from waiting room as I wait out with the boys. Not that I have anything against the boys, but I wait there with 20 guys every single time I come. And I can't imagine other women in other parts of the city who don't have transportation and don't have any way to get there and are ashamed of having their HIV status, as many women are because we're so discriminated against. So these things need to change, and I'm looking forward to seeing a change. And not only that, but Annie Easley has been she was my nurse practitioner for a long time. Before I started seeing Dr. Fossey, I have the most amazing doctors. Dr. Adams, I just saw another PA the other day. I mean, you guys are amazing, and I would not be here without you doctors. Honest to God, I would not be alive today had it not been for Dr. Fossey and Annie Easley. So please help us get the union together so the doctors have more time with us.
We love taking care of you, Savannah!
Thank you, Savannah. Just real quick, just on stats, women, particularly, Black and Latino women as well, continue the hardest hit with HIV. AIDS is the leading cause of death for Black women, ages 25 to 34. It's the leading cause of death, so we definitely need more services. Thank you. Next, I'd like to introduce Florencino, another patient of AHF.
Florenciani.
Florenciani, my apologies.
Oh, okay. Hi everybody, my name is Florenciani, and I have to echo the sentiments of this other patient that spoke, and I want to thank you guys so much for being here, and I want to thank the doctors, especially. I'm really indebted to the doctors. I am an entertainer with some nerve damage right now. A year ago, I had full-blown AIDS and was very out about it and a few days away from death. And I am indebted to these doctors at AHF, and I want to call out Dr. Ann Easley, who's right beneath me, and Dr. James Adams specifically for not only bringing me back to life, but also getting me to undetectable. So it's been a miracle of sorts, and I have seen AHF over the years, and I have seen changes, and I came here to say one thing specifically, and that is, with all due respect to Michael Weinstein, I do not believe that it is the business of AHF to conduct a moralizing campaign on the use of condoms in the adult industry, and to spend millions of dollars that is spent on AIDS charities and AIDS businesses to give us better care, to be thrown like that when we, the patients, really need more staffing, more doctors, and more care for everyone in our community. Everyone deserves their dignity. Everyone. And I am here today because of that, because I really believe, sincerely and wholeheartedly, that I have seen a reduction in staff in the clinic. I am really grateful to the doctors. Even the doctors say they cannot, give me a follow-up call to let me know what a test result is. And it's not just the doctors, it's the staff, the reception desk, it's the people that work in the office. I mean, everyone is working their butts off, and you can tell that they're short-staffed. You can tell when you walk in to the Beverly Hills location. So I want to just put my heart out there and the voice out there to let you guys know I am not ashamed at all to say that I am an AHF patient, and I'm very proud of what these doctors have accomplished. But we need the funding to be allocated properly. So, the voice of the patients, thank you for giving me a voice here today, doctors, and thank you, doctors, for having a voice and for being out here, standing up for us, and that's why we stand here for you. God bless you.
Thank you, Tony! Woo!